According to the U.S. Department of Health and Human Services Office of Minority Health, on any given day, there are 100,000 men, women, and children on the waiting list for organs. Every 10 minutes, another person is added to the transplant waiting list. Daily, 17 people die while waiting for an organ transplant. African Americans make up the largest group of minorities in need of organ transplant, with the most commonly transplanted organs being kidneys, heart, lung, and pancreas. While Blacks compose approximately 30% of persons waiting for an organ transplant, they only account for 15 to 18% of organ donors. The need for donation and transplant is more pronounced in minority communities, where higher rates of hypertension, diabetes, and heart disease contribute to organ failure, especially kidney failure. Why are African Americans reluctant to become organ donors? There are myths in the Black communities that impact the willingness for this population to become donors. Myth: mistrust of the medical system is the most common reason for reluctance to become an organ and/or tissue donor amongst Blacks in the U.S. The thought is, if I register to become a donor, medical personnel will not attempt to save my life in an emergency. Truth: doctors, paramedics, nurses, and other medical staff are extensively trained to make saving lives their number one priority. The medical team that is assigned to recover organs is entirely different from the team that cares for you in the emergency department. Myth: organ donation is against my religion. Truth: most major religions support donation for transplantation as a charitable act of love for one's fellow man. Others will recommend that the final decision on this act is an individual decision. If there is a question, one should consult their clergy or spiritual advisor. Myth: I am too old to become an organ donor. Truth: there is no age limit for registering as a donor. A 99-year-old can register to be an organ donor. Myth: my family will be required to pay for the organ donation process. Truth: there is absolutely no cost to donors or their families for organ donation. Education about the need for organ and tissue donation in the African American communities is imperative to help save lives in our communities. Honest discussions about the common myths and other factors that encourage reluctance must be had. A diverse donor registry gives ethnic minorities on transplant waiting lists a better chance to find a good donor match. Additionally, it is important to know that every donor can save 8 lives and enhance the lives of 75 more with skin, bone, corneas, helping people with burns, fractures, visual problems, and other medical conditions. We must share how we can improve all aspects affecting our Black families, including physical, environmental, occupational, and financial health. I am Marie Devereaux Padilla, cardiologist. I am Rosalind Daniel Walker, public health advocate. We are the Eastern Area Health and Human Services Facet co-chairs, serving under the leadership of Madam Eastern Area Director, Dr. Lisa Lowry Lomas. We believe in achieving excellence in Black families by elevating friendships and empowering families.